Welcome to the Livin'Sky podcast, a show about raising connected, resilient kids in a world that often forgets what they need most. I'm Lena Livin'Sky, a pediatric speech-language pathologist, holistic feeding specialist, and a mom, here to help you understand your child's body, behavior, and biology in a whole new way. Each episode brings you simple, practical tools to support healthy eating, development, and family connection without the overwhelm. Thanks for listening. I'm so glad you're here. Let's dive in. Welcome to the Livin'Sky podcast, your go-to source for healthy living and valuable insights into child development and family health. I'm your host, Paulina Livin'Sky, or Lena for short. As an SLP specializing in feeding, and most importantly, a mom, my work in holistic health reflects both my professional experience and personal journey. For over a decade, I've passionately studied and researched this field. Now I work with parents of children with chronic disorders, helping them heal and thrive. Join me for a mix of solo and guest episodes featuring experts in the health and wellness space. I can't wait to dive in, and also, I have a toddler, so I gotta get going. Let's get the show on the road. Welcome to the Livin'Sky podcast. My guest on today's show is Dr. Jessica Harden, who is a native of Charlotte, North Carolina, and my very personal chiropractor. Having spent over 12 years in the field of chiropractic and being a natural mama herself, Dr. Jessica's approach to health aligns very much with my own. After all, the body is not a series of body parts that are separate from each other and don't affect each other's function. They're all connected. As a neurologically based chiropractor, Dr. Jessica's goal is to create a new expectation of greater health. She utilizes cutting-edge systems and movement X-ray technology in order to deliver the most specific scientific chiropractic care, which looks not only at your body's structure, but also its function. On today's episode, we discuss the importance of having health conversations, the benefit of pediatric chiropractic care, addressing non-pain issues in children, how chiropractic care can help lay the groundwork for your child's optimal development, how chiropractic care can benefit children diagnosed with ADHD or autism, as well as children struggling with their gut health and feeding, how to find the right pediatrician, benefits of chiropractic care during pregnancy and for fertility, as well as postpartum care, and so much more. This episode is value-packed, and I hope you will find answers to your pediatric chiropractic care questions. I love Dr. Jess, and I can't wait to record part 2 of this episode, as we could have gone on and on. But without further ado, here is Dr. Jessica Harden. Hi, Dr. Jess. Welcome to the Livin'Sky podcast. I'm so thrilled to have you today.
Good morning. Thanks for having me on this morning.
Yeah, I mean, once I started seeing you as my chiropractic doctor, I was like, I knew I had to have you on at some point because I just admire you so much, and I'm learning so much from you, and feel like we have to share your knowledge with the world.
Yeah, it's an honor to be on your podcast. I really appreciate everything you're doing to get this messaging out to more people, because we need to have more conversations about these things, because it's not coming mainstream through our pediatricians or our medical doctors. And there's a lot more options out there than there used to be. And research is showing that, the more action you are proactively in your health, the more vibrant your health will be in those later years. I definitely see a trend changing in our country where people have watched their parents go through a certain process with their health and they don't want to repeat it. And so they're researching more, they're reading more. I have more people well-versed in this realm of conversation that we're going to have today. And it's refreshing. It really is refreshing.
It really, really is. And I think so many of us now who are awake and aware of the health trends going on, we're working on our health. We're trying to get healthy. We're trying to get better and doing all these things. And I think starting with our kids and just building these beautiful foundations is really what we need to do as well. So this is what we're going to talk about today. So I'm super excited.
I am too.
So can you explain to me what pediatric chiropractic care is and how it differs from adult chiropractic treatments?
So to kind of start out, I classified myself as a neurologically based chiropractor that sees families, right? Like myself and other colleagues, we have a joke. We say we see people from the womb to tomb, right? So we see all ages in our office. And you have to understand something about kids. Their pediatric spines are way different from adults for a lot of reasons. One, the more obvious, their bones are smaller. They're more flexible. And truth be told, they haven't been subluxated as long as you and I. Okay. So you have to keep those factors in mind. And those of you that are listening to the call that are not familiar with the word subluxated, it actually comes from thing that we analyze and correct in our office, and it's called a vertebral subluxation complex. And essentially what it is, there's shifting in the vertebral bones. It creates pressure and tension on the nervous system, and therefore disrupts the messages coming from the brain and distorts messages coming from the body back into the brain to help with its wiring and developmental process, which is going to be important when we talk about kids. Now, when you see a pediatric adjustment in a chiropractic office versus an adult, it is not the same way. There's usually one of three ways that it's done. Oftentimes, it's gentle, very light, sustained pressure to help glide bones into proper alignment or to take pressure off of certain areas. When the kids are a little bit older, there's also instruments you can use. There's light force instruments that click or tap. And then if the kids are a little bit older, you could even move into what we call a drop table, which is a table that will move as you apply a force, which allows a gentle correction on the joints in order to allow that correction to take place. But as you can kind of get the gist of what I'm describing, it's a gradual process, right? So it's age dependent, it's condition dependent, it's how their nervous system has been impacted. A pediatric chiropractor is trained in a myriad of ways to address subluxations so that that child can be as vibrant as possible.
Absolutely. And do you feel like this is something that is necessary for children's health? Is it helpful? Can it relieve any types of symptoms or disorders that they might be struggling with?
Yes. So here's what you have to understand. We do not see kids for pain reasons in our office, which is why what people think of when they think chiropractic, like, oh, I have this back pain, I have sciatica. When's the last time you heard a kid complain about like sciatica? That's not the case. So the reason why parents bring their children to our office is because they know there's something dysfunctional going on. So we're talking about disruptions in digestion, sleep habits, latching issues, even not meeting developmental milestones. And so parents know something's not right and they cannot figure out how to get it addressed. And so when they come to our office, they're asking us to look at the most fundamental system in that child's body, which is the nervous system, find out where distortion may be happening so that we can gently get it corrected, allow that child's brain to better perceive its environment, and allow that body to start the healing process too. Because truth be told, we have to check kids as soon as possible because of how fast their nervous systems develop. So to kind of walk through this, think about this. By the time you're age 6, you have a fully functioning adult nervous system. 6. You already have it, right? So that means the window to really make significant change in a child's health has to happen before 6. And even before that, before age 2, something called 90% of the myelination of the nervous system occurs. Okay. So when I say myelination, think about wires. You know, they had that little rubber cabling around it to protect the conductivity of that wire. That's what myelination is in our nervous system. And that is 90% complete by age 2. Okay. So now you're talking about, now we just talked about before 6, now we're talking before age 2. And so you're wondering like, okay, can anything be done, even at birth? Well, the answer is absolutely. And oftentimes we have to see children immediately because of how much pressure can apply with the birthing process. And we can get into that later. But that's essentially why we see kids, is so that they can start functionally being better from the start, meet all their developmental milestones, have a more vibrant life, better immune systems, better digestion, better sleep. And that's going to feed into a better functioning nervous system that will serve them later in life as an adult.
Absolutely. It's like laying the groundwork, right, for optimal development, which is so important.
Absolutely. And I think sometimes when people think about pediatrics, if they think of a pediatric chiropractor, they even think of things like scoliosis, which can be helped and addressed with chiropractic. And I can go into the nerdy science with that, but more specific, Lena's looking at me like, oh yeah, I know you're nerdy. And I am.
But that's why I love you.
But it's even more than just from a structural or a postural standpoint. It's like truly functional based is why people seek after a pediatric chiropractor.
Absolutely. And I love that. And I actually had my son adjusted, like he was 4 days old when he had his first adjustment. And I want to get back into chiropractic care because I've been coming to see you for my own personal reasons. And then I'm thinking I have to get him back in. I have to get him back in because there's so many things, so many ways he can benefit from having these adjustments, Definitely. Like you said.
And we have plenty of kids that we see for wellness purposes. It's not that there is actually a diagnosable condition that we're trying to help that child thrive within or overcome. And then we can go into ADHD and autism even potentially with this conversation. But we want to make sure that we get rid of the subtleties that create disruption. And I mean, we can go on a tangent here too as well. Vertebral subluxation is not life-threatening, but it is life-altering. And so the earlier that we can get it addressed, we know that body will be vibrant as it's going through its developmental process and growth. And that's essentially why we want to make sure we check kids as soon as possible so that we can do a lot of preventative work of what may happen down the road.
Absolutely. So speaking of ADHD and autism, it's such a prevalent disorder right now. I mean, both of them are, right? Because we have 1 in 10 kids about right now with ADHD, 1 in 36 and 1 in 32, I believe, in California with autism. I mean, the stats are just growing.
Yes.
And the chronic disease in this country is just getting really out of control. So
yeah,
is there a connection?
Conditions that you weren't seeing till 30 or 40. And we actually, we have we said it 10 years ago. We are saying it now that we have a health crisis and it is getting worse. So there are so many things that go into this. We can go into toxins. We can go into our social structure. We can go into the trauma that goes into the birth process, the foods we eat. There's a long list. So you'll never hear me say that chiropractic is a cure for anything. Chiropractic is a facilitator to allow that body to heal and operate as optimally as we can. So when we work with kids that have ADHD or on the spectrum, by improving their function, we can see that their bodies regulate better, that they can handle stressors or stimuli better. You don't see their threshold. You see almost like their threshold for tolerance increase. And, I would never say go to a chiropractor and your ADHD will be cured, because that's not going to be the case. Because remember, I said it was a facilitator. So oftentimes we have conversation with parents that have goals in helping their child operate better with these diagnosable conditions. We have the conversation of what specifically about this condition is disrupting your life. Okay. And then that is what we're going to use as a marker. So if it's sitting still and focusing in class, I'm like, okay, tell me how the reports are with the teachers. What color cards are they getting? And then we use that data to understand if their body has a better ability. And it takes a team. You have OTs that are very skilled in working through these things. And I have many parents that work through this. You've got nutritionists who can help really analyze if there's any allergies that are irritating their body and creating an inflammation response. So even though I work with this, I would not say we're the only avenue to address in these equations. I do think that it takes a team of professionals and resources. And if I can encourage parents who are dealing with these neuroatypical kids, is everything you're doing, it may seem cumbersome and it may seem intense to do all these facets, but you're literally going to set this child up better developmentally as an adult if you don't do this versus if you don't. So just encourage that all of your efforts are not wasted. All of this stuff is important, especially. So
absolutely. And it takes time, right? Because this is not like a quick pill you're taking to change something. This is work that you're going to put in that will pay off over time, like you said.
Now, there's one more thing I want to say about the spectrum. If you look at when this is diagnosed, when do they usually diagnose kids with ADHD and autism? What age?
Well, autism is around 1.5, 2, right?
Well, you can start picking up the signs, but the official diagnosis hits around 5, 6 years old.
5, 6.
Which, guess what? That's when we have a fully adult developmental nervous system, right? So if you see the subtle signs or you check in with a professional who can pick up those subtle signs, that is when you need to take action, especially. So that's why, if not anything, you're just checking in to make sure that, the nerve tension, the milestones, all of those things are being met. So those little things can be picked up now to try to optimize.
Absolutely. Absolutely. And usually your intuition will tell you as well, right? As a parent, you kind of know something's wrong, something's off, something is starting to happen.
Their guts know.
What can I do?
Hear, there's nothing wrong, that we have to wait and see. Mom shouldn't settle for that answer. They should keep searching, keep looking.
Right.
And those efforts.
And if that's the answer you're getting from a pediatrician or from a doctor, it's okay to change and shop around and look for a provider that you agree with and is going to actually listen to you and pay attention to your concerns.
And there's some amazing pediatricians out there. Oh my goodness.
Yes.
I've heard colleagues say it's like chiropractic versus medical. And I don't buy into that, because there is a lot of people becoming more informed about alternatives for better health. And so I think too, as well, you got to understand how medical doctors are trained. And if you understand where their training comes from, and then also that they're held hostage by something called standard of care and insurance companies. They have their hands tied through their training and what rules they have to operate in. And so you have to give them some grace sometimes in what decisions or things they can say or can or can't do. But there are plenty of pediatricians out there that are private practice, or they want to practice a certain way because they know it truly will benefit the child. And so you just have to do your research, ask around, ask your friends, ask other people that already think like you do or are looking into the same stuff as you, and you'll find your team. You will find your team.
Yes, they're around. And you can look for pediatricians who have more of an integrative approach or holistic approach. And there's more and more clinics coming up with like a monthly payment plan. So it's not necessarily they don't get covered by insurance, but you might be able to be part of their membership. So you can see them for like maybe $100 a month or $150 a month. So it's not such an astronomical number. It's extra money, but it's not astronomical, because I feel like back in the day, you would think that it would be like thousands of dollars to see these doctors, but it's not the case. It's actually, it can be affordable and it's easily accessible. You just, like you said, just have to do your research.
Yeah. And truth be told, a lot of these private practices that are membership based, the pro of it is you have faster access to these doctors.
Yes.
I have practice members like, yeah, I need to see a pediatrician, but they couldn't get me in for 3 days and my kid's already got a bad ear infection. And so they have to rely on telehealth or urgent care, which really gets expensive. And so, finding a pediatrician within that model is not going to be a waste. It's going to be an investment for sure.
Absolutely. In your health, right? Versus just getting that quick fix. Or about 70% of antibiotics are overprescribed. So oftentimes that's going to be the answer, going to a regular doctor.
And if a child has an antibiotic before age 6, only one, their increase of asthma and allergy issues increases 200-fold. Yeah. And the reason why is you got to think about it. Antibiotics hurt gut health. Gut health's not good. Inflammation occurs. Conditions occur. Asthma is an inflammatory condition. A lot of people don't realize it's just an inflammatory condition of the lungs. So it's really important to try to minimize the use of those things in the ability. And if you're a mom listening in and your kids had to do so many antibiotics, this is not a shaming statement at all. This is a chance to learn and grow too as well. And so, I've had moms that are like, man, we've done like 10 antibiotics. We just can't get this under control. It's like, okay, well now you need to support the gut health now to try to reverse what you had to do with the tools you had at the time. So I never judge parents by the health decisions they make. I know everybody's just trying to survive, sometimes when you're a parent. So truth be told, commend you for surviving parenthood.
Right. Oh my gosh. Yes. Props to you. It's not easy, but I agree. And it oftentimes comes from the lack of awareness, and because you look up to your doctors thinking they're going to give you the best thing, they're going to do the best thing for you.
And unfortunately, training provides them.
Exactly. That's exactly what they're trained on.
No, I don't fault the nutrition. I fault the fact that that's how the system trained them.
Yes, exactly. Yeah. And it's, they go into this school oftentimes because they want to help people and they want to make good in the world and just make a change. And unfortunately, they become part of the system. So there's just a lot to be said here. But like you said, there's things, if this has happened to you and unfortunately you had to have given antibiotics to your child, there's nothing wrong with that. You can still rebuild their gut. There's so many things you can do to rebuild.
Definitely.
Yeah. And is chiropractic care is part of that? Does it help you with your gut health?
So you have to understand that digestion and gut function, a lot of it comes from a nerve called the vagus nerve. And the vagus nerve exits out at the very upper part of the neck around the cranial area. And if there is abnormal tension and tone here, it will disrupt the key buzzword right now is vagal tone. If you ever heard that term dropped, and it's like, chiropractors have been saying this for like decades, like it's just catching on. And it's because we understand that if there is abnormal tension on the nerves, then that will cause disruption. And, the vagus nerve specifically, and where it's getting a lot more recognition, it's almost easier to say what it doesn't control than what it controls. And so a lot of times they're seeing kids with something called low vagal tone, creating these dysfunctional patterns. And oftentimes it's digestion, reflux, constipation, diarrhea, those types of things. And so it makes sense that chiropractic can play a role in improving that vagal tone and helping that child restore their health.
Absolutely.
Honestly, yes, there are probably some environmental things which are important, but from a foundational standpoint, is just making sure that tone gets corrected and addressed is going to be extremely important.
I'm a huge believer that light is one of the most powerful medicines for our kids and for us. That's why I love Bon Charge. Their blue light blocking glasses, red light therapy devices, and many other products are designed to support your circadian rhythm and help your family sleep and feel better naturally. In our modern world of screens and artificial light, these small shifts make a big difference. Calmer evenings, deep sleep, better focus, and happier moods. I use Bon Charge products every single day, and even my son has his own pair of blue light blocking glasses for evening story time. You can check out all their products at boncharge.com and use code LENAL to save 15% off your purchase. Absolutely. And I have sent my patients, because I work a lot with feeding, to chiropractic because of constipation and reflux, right?
Absolutely.
Just because it can be so helpful. Yeah. And it's something that can happen almost immediately in some cases, not in every case, but it's such a relief because then that affects feeding and everything else. And it's just like such a holistic view of the body that we sometimes don't think about, but it's all connected.
That's right. And I mean, from a breastfeeding perspective, I mean, you think about like lactation consultants versus the IBCLCs, right? You know, a lactation consultant, they're like, yeah, you know, I was at the hospital and, the LC like helped me with the latching part. That's only one element, because you got to think about how that jaw's like moving. Is it actually able to address the milk? How much milk are they actually getting in each try? Do they get exhausted? I hear a parent say, yeah, my child's lazy. And I'm like, no, your child's not lazy. It's really, really hard for them to feed. So they're running out of energy. So they just give up. It's not that they're lazy. And so it's interesting how we try to interpret what that breastfeeding is supposed to look like. And we're like, oh, well, my child is just a certain way or a personality. And really there were subtleties going on, tension patterns that they just couldn't nurse effectively or easily enough. So where they've had to find other ways to adapt. And that's a whole nother discussion.
Yes.
But an IBCLC is someone who can really triage that. An OT can also triage that as well and really try to isolate what's going on. So if you're having breastfeeding issues, you need to get in contact with at least an OT, an IBCLC, or have a discussion with a chiropractor. I think any of those three is a great place to get started.
Yes. Or my functionally trained SLP who can diagnose a tongue tie or anything like that.
That's right.
Yes.
That's right.
Yes. Let's not forget our SLPs.
I know. I'm sorry. Yes. Those professionals do.
No, just because I'm an SLP and I'm like, I'm there too, but actually I'm not myofunctionally trained. It's just not what I do. I had this issue with my son because latching was so painful for me.
Yes.
And it took me about 6 or 7 weeks to really establish a good breastfeeding routine, but that's because he had a very tiny posterior tongue tie, which was really initially when the pediatrician saw it from, which I suspected that was there, but he said it's so small, it probably doesn't affect nursing at all. And I'm like, okay, but I'm going to go and get it, evaluated as well, just in case. And we did have it clipped, and you know what? It was night and day. It was completely, this is when everything started to work, and like a well-oiled machine. It's these little things that we don't really think about. And if there's any pain or anything going on when you're nursing, and if it's really hard to establish a nursing routine, like you said, really seek out this help because it can be life-changing.
Absolutely. And, it's funny, you and I are professionals. We've worked with kids, babies, and we've been through very similar experiences. Like I also, when my son was born, we had some nursing issues where it was very painful for me to nurse. And so you think like, well, chiropractor and all these other people that are in health, they never will have these issues with their kids. And it's not true.
Right. No.
And the reason why is this stuff will happen through the birthing process, through, as you're working with the kid, as far as like feeding, positional, all these things. And so the story of my son is he did have a tongue tie, but it was mild. Mm-hmm. But like you, I'm like, well, let's see if we can get it improved. We actually opted for something called baby laser, which is basically like a laser therapy that breaks up the adhesions in the tissue. It's not a cut, but it actually helped with the mobilization of his tongue. We were able, and I did cranial work and all sorts of other stuff on him. And we were actually able to get around doing a revision. Although I absolutely, if it had been bad enough, I wouldn't have hesitated. But because it was more mild, I'm like, man, maybe there's something we can do to improve the function without having to go all the way to the extreme when he does have some mobility, but it's just not ideal, right? So again, there's so many different things out there that we can do too as well. And thank goodness we have more people weighing in on the equation to help you triage this and try to walk through the subtleties. And you don't want to settle. Like, I'm just going to muscle through breastfeeding pain. No, breastfeeding should not be painful. That is a
No.
time you need to look a little deeper and try to figure it out. That's all.
Absolutely.
You're doing something wrong. I'll tell you that.
No, and neither is your baby, right? It's just you guys are trying to, the baby's trying to survive, you're trying to provide, and it can be such a stressful time, but there's so many things you can do. And like you said, body work is so important for babies.
Yes.
It's just,
that's right.
It can help so much with any breastfeeding issues, but
yep.
Yeah. Is chiropractic care actually recommended during pregnancy? Are there some benefits having chiropractic care before birth, like in terms of, I guess, the birthing process and perhaps for the baby as well?
Yeah. So there's a philosophical debate that we chiropractors will have, and it's like, where can you make the most impact in the next generation? And the answer ends up always coming to preconception.
Mm-hmm.
And if not preconception, pregnancy. If not pregnancy, birth. If not birth, before age 2. So you can see how it stacks up over time. So, but yes, absolutely. There are very safe techniques out there. There's something called the Webster technique. There's an organization called the International Pediatric Association. It's an international association that literally is dedicated to making sure that we as chiropractors are trained to, in this Webster technique, to deliver safe, effective care. And when it comes to pregnant women, we have to understand that if we can impact that mom's pelvis and spine, and there's 3 ways that we do impact it, that we can allow that mom to increase her probability of having a safer and more positive birth experience, which means less trauma on baby, which means less probability of some of these things that we talk about arise that come from body distortion patterns, whether it be in the cranial area or the cervical or lower spine area. So a lot of times when working with pregnant moms, the way I explain it, I said there's 3 ways that we're impacting your health and making sure that you have a better pregnancy experience and a safer birth. One is the biomechanical part, right? So we all know that when it comes to the pelvis and baby goes through, it has to open up, right? And if there is locking in that pelvis biomechanically, then that sacrum can't drop down, that pelvis can't open up as effectively. So then baby transitioning into the birth canal has difficulty twisting and moving back and forth to make his way out. And so that's one way. The second is through muscle tone. So if you have misalignments in your pelvis, the tension in the ligaments and the muscles will be different on one side or the other. So babies will favor different positions because they don't like to be in areas of stress. And so there's certain sustained contacts, things you can do to balance out the muscular system after correcting the pelvis to try to help make the pelvis as balanced as possible so baby positioning can be achieved. People are very familiar with seeing a chiropractor if you have a breech baby. I would not want to wait till you have a breech diagnosis to see a chiropractor, but I do have some moms that will come in, they're 38 weeks, and I'm like, we got some work to do because we're down to the deadline. I obviously commend you well before that to make sure that your pelvis is ready and prepared to allow the baby to find that optimal position. And then the last one, third, I did say we were a neurologically based chiropractic office. You know, when it comes to laboring, your brain has to connect with those reproductive organs to make sure that they're contracting and that the rhythm's great. And just from overall function as far as like posturally and getting into certain positions. So your brain is responsible, obviously, for a lot of that proprioceptive work. So there is a lot to be said in making sure that you have chiropractic a part of your prenatal care so that you can optimize your birth outcomes.
You know, these days when your child refuses everything you make and you just want them to have something nourishing, that's when I grab Signals. It's a real food meal replacement shake made with organ meats, minerals, and nutrients that support kids' biology, not just fill them up. It's rich in iron, zinc, and B vitamins, the building blocks for growth, focus, and strong immune systems. And it's great for the gut. And the best part? Nate calls it his ice cream shake. That's how delicious it is. And as a mom, it feels amazing to know he's getting what his body truly needs without the fight. You can learn more at feedyoursignals.com, and don't forget to use Lena10 at checkout for 10% off your purchase. Absolutely. And I think it also, I know it helps with fertility because I personally helped from a chiropractor when I was struggling to conceive. It was about 6 months. I really couldn't conceive. And I actually met a chiropractor at a party, and he it was interesting because I feel like intuitively I kind of knew I wanted to go to a chiropractor to try to see if it helps. But he started talking about it. He connected me to this office. And then I continued to hear about chiropractic care from like podcasts and all these things. And all of a sudden it was everywhere. And I was like, all right, well, I guess I need to give it a try. And this is how I started going to a chiropractor. But after only 2 adjustments, I got pregnant. They can really help.
I know. We've seen it's really cool to be a part of that journey when it happens too. And I will say something about infertility. It's on the rise as well. Just like we talked about health in general. Just in the last like 3 decades, the number of IVF clinics that have opened up, or we'll call them infertility clinics, have opened probably, I think I saw a stat, I was sitting in a seminar, it was like 400 to 4,000 in only 10 years.
Oh my gosh.
So there's a lot to be said that from preconception work, it is extremely important. If you plan on having a family, making sure that you and your husband, because it takes 2 to make a baby, are pursuing optimal health through your nervous system, through toxin exposure, those things, it's important. And I think too, as well, people think prioritizing that is hard, but it's even harder, like to be trying and then spend thousands of dollars on infertility treatments to try to conceive too as well. It's a really tough battle. You know, I've even had people that it doesn't happen instantaneously like that are pursuing infertility right now. And I firmly believe there's just so much going on in our world as far as toxin exposure, those types of things, that there's more that needs to be done, nutritional deficiencies that aren't being detected by your usual medical doctor team. And there's tons of people investigating this and looking for ways to restore natural health too as well. So this is not going away. This is going to continue to increase, which is why we need to be more mindful about our health choices. Absolutely.
And I got lucky because this was something that moved the needle for me. But like you said, there's so many different things you need to look at and really to care for your body. And when is really the time that we should start? I mean, we should, of course, I firmly believe we should always be doing this. But if you are planning to conceive, how much time do you need to prepare for that conception?
So you got to think about how long it takes for sperm to develop and an egg to develop. And usually it's about 3 months, 90 days for a mature ovum. And husbands, I think it's like 30 or 60 days. It's a little bit quicker, right? It might be 30 days if my memory serves me right. So honestly, I would want probably 2 to 3 cycles of each partner as far as like developmenting good germ cells. So women, I would probably say, like, if you're really pursuing this, maybe anywhere between 9 months to 12 months, and guys at least 6 months. So that way there's plenty of time and plenty of regeneration that occurs in order to create that. So in my opinion, that would be a good place to start. And also nutritionally too, as well. You know, prenatals, you don't have to just start taking them just because you're pregnant. You can start taking things like folate previously. So the year before we actually were trying for our child, I was tracking my cycle. I was already taking folate and some other vital B complexes, omega fatty acids. So I was taking a lot of nutritional things, knowing to try to prepare my body for nervous system development that happens within the first few weeks of conception. So there's a lot. And so having that in your system ahead of time, like let's say you're in the process of getting married. Okay, just in case you're one of those few women that gets pregnant on her honeymoon, maybe this is the time to make sure that we're nutritionally feeding up our bodies so that even if it is a amazing blessing of an oops, you're going to be able to have confidence that your body was already prepared for it. So
yes. And I really do think that helps with the postpartum period as well. Because for me, I had a really hard postpartum period because I did not prepare as well. I was definitely in a different mind space when I got pregnant. And if I do try for another one, which hopefully I will be going into this with a completely different preparation and mindset.
And postpartum care is the least supported period in women's lives.
It's so hard.
I try to explain to women like, hey, I'm taking care of you prenatally, but you really want to invest in your postpartum care too, because there's not a lot of, unless you're actively pursuing, that support's not quite there. You can get support too from your doula. Doulas offer postpartum care support, which could be a great to have a coach in your back pocket to kind of bounce things off of, because it is a vulnerable time. So even from like the health perspective, making sure nutritionally you're ready, chiropractic you're ready, just having other team members in place to support you through that journey is important for sure.
Yes, absolutely. And we are meant to have a, community around us after birth, because this is just how we grew up. I mean, this is how our society developed, but over time things have changed because of the work habits and the lifestyle habits that we have. But as women, as actual mammals, we do thrive. We seek that community. We thrive having it. So it's so important if you are able to have a community around you, whether that's your mom or your grandmother or a sister or a friend, anybody who can help you through this time. It is just so crucial to have that help. So let's shift our conversation a little bit, because chiropractic care can be a little bit misunderstood, I feel like.
Yeah, definitely.
And yes, and part of that conversation that kind of shines a negative light on it is hypermobility, because some people who are hypermobile have reported that chiropractic care has completely destroyed their bodies. So do we assess for hypermobility before we start getting adjustments? Like, what is really happening here?
So there's two things to this equation. You got two sensitive communities. You've got hypermobility, and you got neurologically overstimulated, like to the fact that their nervous system's just fatigued, right? And these are very sensitive individuals to work with. In our office, we do neurological testing to understand the narrative of what the nervous system is undergoing. Is it traumatized to the point where it's just like it's overstimulated, or is it just a high strung mode and it can't come down? There's things you understand about that part. And then from a hypermobility standpoint, in our office, we do a motion study. We have a DDR, dynamic digital radiography, or motion x-ray, to assess how much motion is in that spine. Some people are more flexible. So if it's more flexible, you have to be cautious about how much input you put into that system so that you can honor the flexibility, but make the corrections needed. There's some hypermobile people I will still hand adjust. There's some I would not do anything past pressures. It just depends on the case. And so having a chiropractor that has different tools to kind of understand the category you fall in, to adapt the care to what your needs are, is a really important part of that process. If you have a hypermobility condition, say Ehlers-Danlos or osteogenesis imperfecta is another one too as well. We need to understand how mobile certain areas are, so we can understand to stay away from those areas or address them a little differently too. You would be shocked at how many people have a very, very mobile atlas, and it isn't from trauma, and it just happens to be something that they're born with, and there are ways to handle it correctly and safely. And so I think, in my personal opinion, if you suspect that you have hypermobility issues, I absolutely would be encouraging that you would be to have that conversation with your chiropractor about, hey, how can you handle and work with hypermobility? What's your comfort level? Because the other problem with hypermobility, what happens is, though they're so flexible, they have the tightest muscular system. And the reason why is because of the extra mobility, the intrinsic tone of those muscles have to be tighter to try to create some sort of stability. And so there's got to be a myriad of conversations to help work through those things too as well.
Absolutely. So if somebody is hypermobile and they're looking chiropractic care, how can they find an office kind of such as like yours, who is looking for these types of symptoms prior to adjusting and taking on the care? How can we make sure we're going to the right office?
So first of all, you want to make sure they can understand have a narrative of what your nervous system is doing. So some sort of testing, some sort of, and it doesn't even have to be, we have sensor tech that actually gives us a understanding of the muscular system, the nervous system, and your adaptability through your heart rate. Okay. Some offices will use some level of muscle testing or strength changes or a myriad of parameters to understand what strength and integrity is in your body. So it may be a series of motion, flexibility tests, wall sitting, something like that. So that there's something on their website tells you kind of what goes into them assessing you, right? I definitely think x-rays are vital and important. And I would absolutely say a chiropractor that uses x-rays frequently, and not by only if there is a problem, i.e. meaning, do you think you need x-rays? Is another plus and a benefit too. And then of course, if they don't use x-rays, at least they are utilizing certain types of adjustments that are lighter force. So they talk about things like tonal adjustments, instrument adjusting. If you see the words of things that are referencing the nervous system frequently and not just restoring motion, that's another clue. So these are all little things that can kind of lead you through it too as well. If they are a family practice, they will have to be well-versed in lighter force techniques. And so if they see kids, then it's another foot in the right direction too. So there's a few things. Not all chiropractor offices are tech heavy like we are, but there are some that use other tools instead of tech that are super effective in making sure that their care is crafted correctly.
Absolutely. And your office actually uses thermography
Yes.
to scan before and after an adjustment.
Yes.
So can you talk a little bit about that?
Definitely. Thermography is established in research as the most effective way to establish the nuances of the autonomic nervous system without being invasive. If you've ever heard of something like a nerve conduction test study, they literally have to put things into your body and shoot electrical impulses to assess how efficient those nerves can send messages, okay? We don't have to do that because thermography gives us an idea of how the body is responding from its autonomic standpoint. So, and when I say autonomic, I mean the part of your nervous system that controls like your heart, your lungs, your digestion, those things you don't think about, right? So all your internal organs, okay? Autonomic nervous system also controls capillary function, so blood flow. So if your autonomic nervous system has imbalance, it will prohibit its ability to dilate and constrict the capillaries, the subdermal temperatures on your back, and therefore you'll get what we call a pattern of imbalances. Rewind, neurologically based. So if you have tension patterns in your nervous system, those areas that are being controlled through the capillaries won't dilate and constrict in a unique way. So as long as that subluxation presents, that person will continue to have those imbalances. And by tracking that and seeing how it changes and transforms gives you clues as to do more, do less, move on, or change up how you're working with the nervous system. It does give you clues from visit to visit. And so I like using it from visit to visit because it lets me know we're moving forward, right? I don't tell people it's a gauge of how well you're doing. It's a gauge of if you're moving forward, if we're getting through those subluxations, if they're calming down, if they're correcting, or if we're seeing something reemerge. That's where I like to use it from visit to visit. Now, some offices just use thermography for checkpoints. That's great too. We do the same to assess how that body has adapted to a series of care within a period of time, to assess if they need to change their game plan or keep forward with the current one they're on.
Okay. Well, it's amazing. And for me as a patient, I'm always looking to see like, okay, well, I see patterns. I don't really understand it as well, but I know there's a lot of red. That's pretty good. Or blue. They're kind of looking the same.
Mm-hmm.
So
Most definitely.
it's kind of, it's nice to see that the change because you get to see a few scans next to each other to see how things are progressing.
And true, if you just go by symptoms, here's the frustrating part sometimes. I have someone that has low back pain. Now, do they have low back pain because they're subluxated or they have low back pain because they're healing? How do you know the difference? And that's why having tools to kind of delineate between, no, this is healing versus that. Because I mean, think about when you work out, you're sore after a workout, right? Does it mean the workout wasn't good for you? Said nobody, right? Although some of you would debate me just so you don't have to work out again. But in those cases, like we know that sometimes the body will express symptoms because the body needs to go through some sort of healing to make things happen. So having tools to objectively assess what the nervous system's doing is important, because if I check someone and they're like, man, my low back's been even worse this last week, I'm like, hey, hang in there. I guarantee you another week or so, it's going to feel a lot better. And sure enough, another weekend, they're like, finally, I was like, yeah, because you would have given up prematurely, when really what your body was doing was reorganizing its posture muscles in relation to what was already moving better in the spine. So it's just good to have those things to rely on to say, you're not crazy. I really believe your body's healing. Or an occasional case, maybe something isn't quite right. Maybe it wasn't as obvious as it was originally. I've seen people and we re-x-ray in our office, by the way. I mean, we don't just do the initial ones. We re-x-ray over a period of time. And I've seen people where it was obviously like this shift, and then this gets corrected. And then you see this subtle one on one side. I'm talking about the pelvis here. And it's like, oh, wow, you would never have seen that unless you got the first big boy out of the way. And so now I see this subtle player, and you get that last little thing. And it's like, their body's healing, turned on, they're moving better, functioning better, and it can be a game changer.
Absolutely. And how long does it usually take for, if somebody's coming into you with like a severe subluxation? I think there are levels to it, right? Level 3 or something. Yeah. Depending, I guess, on their age and everything else, because I know it depends on the patient, but like, when do you usually see a shift, if you do?
So with kids to adults, it just depends on the history and how chronic things are. And I'm not talking symptoms. Obviously, the more degeneration, the longer it's going to take, right? I always tell folks, think about credit card debt. You don't make your debt's like crappy because you have all this debt you're sitting on and you make a card payment. Your credit card score is not going to change overnight. It's going to take a series of deposits to pay down the debt in order to get your credit score up. Okay. So your health is no different in this department. I've had some people, gosh, so many people are so different. I've had some people, their first adjustment, they got off the table, they're 90% better. And I'm like, I did not expect that to happen. I've had some people where we've been working steadily year after year, inch them forward too as well. So it varies. It really does. But I will say that if you're wondering how long it's going to take, if you have degeneration, if you have loss of curve structure, if you've had this symptom for a while and you're just now getting to it, just be prepared that it is going to take longer and probably months to years, depending on how bad it is. And it will require some effort on your part to do what needs to happen to improve your health. And it's not that you will never get there. It's just understanding that it's going to take some time, some effort, and diligence to make it happen.
Absolutely. And is it the same for children as well? Or do you typically see more progress with kids?
So kids, when I mentioned before about why we use light forces for their spine, they haven't been subluxated as long as you and I. So they don't need as much force to make corrections. That's why it's easier. So kids bounce back fairly quickly. Again, because their timeline is so much shorter. Now, I will say some of my most traumatized kids through the birthing process, it's not as light night and day. So to give you an example, a kid that's had vacuum extraction, forceps, and ended up finally being a C-section, that's a lot of trauma. That's going to take time. And it will probably be a slow, steady process to work that child through, but it'll definitely need to be a part of the equation. So children, not as much years. Sometimes more so, like let's say a parent's bringing me a nonverbal child to my office. I often say it's going to be a kind of a gradual process because we're trying to regain ground that was lost and continually managing it with the help of other therapies to get this child further along. So again, it's a little bit case dependent, but usually kids you'll see some responses fairly quickly because they haven't been subluxated as long.
Absolutely. And your adjustment style is quite different from what I've experienced in a typical chiropractic office. So can you speak to that a little bit?
Yeah. So we don't use twisting or rotary style adjusting. Mostly it's a personal preference of mine. In school, we are taught things like diversified and things that involve more rotary style adjusting. And in school, I felt through my experience and also personal chiropractic journey that was not the styles that I wanted to use because spines are very sensitive sometimes. Sometimes arthritic changes or maybe degeneration, it can be a little bit too overstimulatory. Sometimes the body doesn't receive it as well. So I kind of do everything from pressures, instrument work. I use a drop table a lot of times. So we're making corrections in a direction. My table will twist, turn, and tilt. And so I can place someone in a direction and still do a straightforward correction. There's also some help and assistance with the drop table is taking some of the force out of it and using more momentum to make the correction. So in my office, you don't often hear pops or clicks or cracks. And when I have practice members say, Doc, when are you going to actually start doing the adjustments where I crack a whole bunch? I'm like, first of all, you're addicted to crack. That's not healthy. And second of all, we've been doing chiropractic adjustments the whole time. And they're like, but it's not the same. I'm like, I hear you. But my goal is to get your body to receive these adjustments and be able to thrive with them. You could get the pop and click and turn if you want, but just because you hear the pop doesn't mean that's actually what did the correction. Which, by the way, if you are one of those people that constantly is like turning their head and doing all these things like in the chair to try to like get those noises, what you're doing is you're only releasing stress out of the side that's already mobile. You're not actually correcting the less mobile side. So you're actually creating and destabilizing and making yourself more hypermobile in that area. And what happens over a period of time, these people are like, oh, I no longer can crack my spine anymore. Like I do all the things. Well, that's because you have extremely hypermobile side and the other side is so jammed down. There's no way that you can get into the right position to release the stress from that joint anymore. Wow. That's when if you're one of those people and you notice you can't crack your back the same way anymore, you were in a really bad pickle and you need to be picking up the phone and calling a chiropractor to get that corrected stat.
Okay, well, that's really good to know. I just checked. I was like, okay.
I don't know.
I mean, I'm seeing you quite often, so I hope
I joke. I
good.
said, look, I'm a jealous chiropractor. I only want to be the one working on your spine. So let's just have it as it is. But I notice people who do that, when they start care, they're like, hey, I haven't felt the need to do it as often. I'm like, great. Then don't do it. Because that's a good thing.
Exactly. That's good to know. But I wanted to ask you, because when I found you, I came from a very bad chiropractic experience where I kind of fell, I want to say, victim to this kind of like bait and switch method or fear-based sales pitch of a chiropractic office before I came to you. And I feel like that is also out there where a lot of people feel like chiropractic is a scam because there's so many offices that just essentially sign you up for this plan, and they talk to you because regarding maybe not having insurance because it's cheaper to do it this way, but you still end up paying like thousands of dollars for maybe adjustments you not necessarily need. So I wanted to ask you about that, about these types of offices and what is your opinion about it?
So in every health profession, you will have these people. You'll have it in dentistry. You'll see pediatricians that are, a kid mill and they're just pumping these kids in and out the doors. You'll see it in all industries. So it's not unique to chiropractic, unfortunately. And I could say when you're in practice, you are trying to make decisions that make the most sense in regards to how you take care of as many people as you can possibly see to help the community. And so I feel that just like with medical doctors, they get into medical because they want to help people. I firmly believe that a lot of chiropractors just really want to help as many people as they possibly can, right? And there are some chiropractors that are very passionate about getting subluxation corrected. And I love it. I'm one of those people. And some people kind of speak of subluxation as a killing type of condition. And I come from the perspective of subluxation is not life-threatening, but it is life-altering. And that is very vital in this equation. So it is a very important, because if you want a vibrant life and you want more choices for your health and you want to have better quality in your later years, it is essential to get it corrected, because subluxation does slowly strangle the vitality out of your health. I mean, it's just evident. It's proof. And so sometimes the passion can get misinterpreted as to, okay, they're scaring me into it, but it's because they're so passionate to try to make you more aware of it. And so I think sometimes the wording gets misplaced too. Also, in my office, we do care plans too as well. Mm-hmm. So in my office, you only owe us for services rendered. And so we offer payment options and things to get the care, because why? It's not a one-time fix. And I think why people are hesitant, they're like, oh, if you do a care plan, I don't want to come in your office. I'm like, yeah, because you think this is going to get resolved in 1 or 2 visits? No, I just want to come up with a care plan because, one, it will tell us if we're making progress, because we'll have checkpoints embedded in it. It will give us something, an idea, a baseline to understand how your body's adapting and healing. And so is a plan. You want a chiropractor to have a plan, because if you're just coming in, going, you're basically using chiropractic as a Band-Aid. You're using symptoms to judge whether or not. And when you use chiropractic just for, oh, I have a symptom, just work on this part of my body and maybe what happens is the real issue continues to deteriorate. And so what used to work 1 or 2 times is now taking 4, 5, 6, and now it's saying 8, 9, 10. And the reason is because you never got the true problem addressed and got restability for correcting the issue. And now you have this problem. And then you say chiropractic doesn't work for you. And that's not the truth. If you truly get corrected and stabilized, you can minimize a lot of things too as well. And so I think a chiropractor that uses a plan of some kind to assess and see how you're progressing is a great thing, not a tick mark down. And I think that if you feel like you're sold into or pressured into a plan, then you just simply probably need to find another chiropractor, because the way he or she communicates to you, y'all aren't a fit, because you may be misinterpreting their true intentions, right? But so at that point, then if you feel that way, just find another. Just like with a pregnant women with OBs, they get 30 weeks in and they're like, well, my OB doesn't care about my birth plan. Okay, then find another OB. Find an OB that does care about your birth plan. I mean, again, it's very similar concept. So if you get assessed by a chiropractor and you just don't feel like you guys are clicking, there are other chiropractors. So just simply pick up the phone, check out another office. I guarantee you, not every chiropractic experience is going to be the same. So
100%.
I think that's a lot of it too as well.
Yeah, absolutely. And I couldn't agree more. And I feel like you just have to go with your gut. Again, for me, something just felt off about the way the plan was presented to me and maybe the education piece of the office. And I just didn't align with it. So this is why I seek care elsewhere.
That's right.
Yeah.
Yeah. And like I said, I mean, some people, there's different personalities. I have some people that are in and out. I need some people want to talk more, right? And so a busier office may not be a fit for you if you really want to feel like you connect with your provider on a frequent basis. So like I said, it's different. So
yes, absolutely. So let's talk a little bit more about the success stories of chiropractic care. Do you have any case studies, or do you wanted to maybe discuss that where a chiropractic care has significantly improved a child's health or well-being?
Yeah. So we actually have some studies published out there. And if you want, I can share you those links of some of the studies we've published.
Yeah, absolutely.
We don't have a pediatric study published, but I have a couple on adolescent idiopathic scoliosis specifically, and a couple of very interesting adult cases that we helped improve a better quality of health. One with hearing improvement in an adult, and another one with lupus. So in regards to testimonials in our office and some of the really good ones, we had a child presented to our office that was nonverbal, and based on their presentation, they were very likely looking like they were going to receive a diagnosis on the spectrum somewhere. And within a few weeks, mom got to hear the words, "I love you," for the first time. And from there, she's like, it was word explosion. Everything was like it was crazy. I never knew how much my kid knew until he started talking. And she said the only thing we had changed was starting chiropractic care. They had, done a ton of therapies and they were making some headway, but it was very slow. And she said, literally, I have my kid. And what's interesting is he's still having some spectrum probabilities, but you can see the other stuff start to diminish too, as well, in regards to speaking and stuff. So, and we started working with him at 1.5. And it's amazing because I now know that as he gets into grade school, he's going to thrive better. He'll still have some of those tendencies that he'll have to work through, but he won't have the same number of challenges as he would have if we had never crossed paths, for sure. And that
Absolutely.
is awesome and amazing.
Yeah.
Gosh, yeah. I mean, and I've been in practice for 12 years, but that one was probably the most impacting to hear a mom in tears saying that she got to hear "I love you" for the first time, which was pretty incredible.
It's so beautiful. It's so beautiful.
So one of my favorites.
No, I mean, I love to hear that as well. And this is what I love about, having this knowledge, is because perhaps you might not, completely reverse something, a disorder. Maybe you will, but there's so many things you can do to improve the outcome or the health of your child through these changes, through changing your lifestyle, perhaps living a more low tox lifestyle, because it's impossible to be toxin free at this point. We're exposed to 80,000 toxins every single day.
Yep.
But just making these changes and chiropractic adjustments and food and sleep and exercise and sunlight exposure, which is so important,
yes.
It can make such a big difference.
Yep. Every bit helps.
It really does. And it all comes together. And just like I said before, just give it time too, because sometimes it could be a few weeks, which is incredible. But even if it's not a few weeks, if it's a few months or a few years, it's okay. You're still going in the right direction.
Yeah, that's right. Sometimes the ball doesn't move very quickly forward, but as long as it's moving forward, it's better than going backwards, which is where most of our country health is going. So
yes,
every little bit helps. It's not wasted effort. I have some people that are caught up over a single symptom and they totally forget to celebrate all the other things that they overcame. And I have to remind them, I'm like, look, there's a reason why your body just hasn't gotten with this one symptom. And so, but nothing has been for waste, because what do you think would have happened if you never started putting your health first and doing more for your health? Well, it would have gotten worse. Exactly. And so celebrate the fact that this is not perpetually getting worse and worse over time, that even though it may not be perfect, at least it's not heading in that direction. So gratitude sometimes can be a huge healing element in our body. If we give our body grace and say, thank you for working so hard, despite all that I put you through, all the stress, all the toxins I put in my body, everything, thank you for working the best you possibly can. I'd say your body does not fail you. It is always working as hard as it can with what you've told it needs to do.
100%. Yes, yes. And, sometimes we have this perception because maybe from the more conventional model, we've been told that our body is attacking itself. Well, that's really not what's happening. It's trying to heal. just through any avenues you can have. So any support you can give it, the faster and the better that healing journey will be. But your body is here to protect you and love you and nurture you and just get you through life in one piece. So there's just respect it as much as you can.
That's right. And I think that philosophy is a little bit foreign to people because we're taught if our body has a symptom, something must be wrong. And that's not the truth. And that we think, okay, there's nothing I perceive that's wrong, so therefore I'm healthy. And the World Health Organization actually said health is not dictated by the absence of disease and symptoms. So we have to just be cognizant of always putting our best foot forward and just doing a few extra things each day that provide benefit to our health, just so we can love on our bodies a little bit more.
Absolutely, 100%. So we touched about a few things we can do to support our children's health in a natural way. But is there any advice you want to give for parents who want to do this? What are some things that are kind of non-negotiable for you and your family, and how you support and how you guys live this natural lifestyle?
Yeah. If you want healthy kids, it starts with you. I know many parents, I feel like all parents would say, I would die for my child. Cool. Will you live for your kid? And when you think about it, how many times do we obsess over our kids and we don't do the things that take care of us, that make us the most vibrant parent possible? And so it's kind of like on the plane when the flight attendant says, put your mask on first before putting it on your child's. There's a reason for it, because if you can't breathe, you can't put your kids on either. So both of you are in trouble, which doesn't make sense, right? So moms specifically, because we're guilty of this the most often, you are worth it. It is not selfish to care for yourself. It is vital so that you can be the best mom that you can be. So that would be my first recommendation for a parent that wants to support their children's health naturally. Also, kids emulate what they see. If they see you doing stuff, they will emulate it more naturally. So you want your kids to have better habits, change your habits. You want your kids to, go outside more. You get your butt outside, right?
100%.
Although back in the day, most of the time our parents would just say, go outside and don't come back till the sun. Like, just get out of the house. And I'm like, I totally get it. I just want to get my kid out of the house so I can clean my house. I'm like,
yes.
Anyway, but all joking aside, I would say the first step is just starting with yourself. And if it's hard for you to get started, recruit help, accountability. Start a club with a mom that you're like, we're just going to walk every day, or walk 2 times a week. Pick a easy, achievable goal. Also, whenever it comes to health, if you want to change it, you can't just stop something or start something. It has to become a habit or routine. And so oftentimes when you want to implement something, if you want to stop something, you have to replace it with something. And if you want to add something, you have to attach it to another habit that's already in focus. So easy one, people talk about drinking more water. Okay, well, before you can brush your teeth, which you do every night, you have to drink a glass of water. Before you put your hands on your keys before you leave the house, you had to have had at least a glass of water. Before you have your coffee, you have a glass of water. Things that are already part of our routine, adding it is easy. If you want to stop a bad habit, you can't just stop it. You have to replace it. So, I want to, I want to do like sugar again, and I'm trying to avoid sugar. Okay, well, you better have something else that has some mild sweetness or is a better source of sugar to replace it. You can't just cut it cold turkey. So if you want success in changing your lifestyle habits, that's how I would recommend going about it, and be creative to it so that you can secure success of actually integrating a habit. And 2, it's gradual. It's not like you change everything overnight. Now, some people are, mildly obsessive when it comes to changes. And I have people that try to change everything at once. And the thing is it really is sustainable? Not all the time. So I would definitely be mindful of that as you're creating change. Like, master one new habit or getting rid of a habit and then move on to the next one.
Absolutely. Yeah. It's not about changing everything about your lifestyle at once, because that can be so overwhelming. And it takes time. Even with the habit building, I think it takes about 21 days to start a new habit or really for it to stick. So just give yourself grace, take time, do one thing that's maybe feels more achievable at first.
Yeah.
Whether that is changing out your toxic skincare that you've been using forever. It could be like little things here and there. Maybe it's just one foundation. Maybe it's just one mascara. It doesn't have to be the whole thing at first.
In regards to
it just takes time.
And you have to understand, like, you kind of got to be an avid learner. All right. What I know now is not what I knew 10 years ago. Like I know way more now in a decade than what I knew graduating chiropractic school. And it's not that, and you just have to, I would say, honor the journey, and that as you learn and make changes, you can't unlearn what you learned. So take action on it. And there are things that I did that I thought were healthy. And then I found out, not so much. So I had to fall back or regroup and research why it would be this versus the other and try to understand. And I think sometimes people look at the journey as like too hard or overwhelming, but it doesn't have to be. It just has to be a journey. It just has to go forward. It just has to make little changes. It doesn't have to be dynamic, right? And so if finances are a concern in regards to investing in your health, make minor tweaks, do subtle things. There are cheaper alternatives to cleaner living and cleaner health. You just got to get creative and do your homework. And most importantly, have a community of like-minded people, because someone's probably already figured it out before you, and they might be able to tell you how to do it cheaper and faster.
Yes. And usually if they're in this community, they're very passionate about it.
Right.
So you can ask all the questions you need. But yeah, vinegar. I mean, vinegar is cheap and affordable, and it's such a great way to clean your house.
It's like so simple. It's like, how did I not know this sooner?
I know, right? Or like baking soda, anything like that. It doesn't have to be complicated. It's actually, I think one of the secrets to being healthy is to do less and go back to the basics, because we overdo it. And it's so simple. It's just get as close to nature as possible.
Yeah.
That's what it is. And it's often so inexpensive, right? Because going out and getting sunlight and getting exposure to red and infrared light and UVA and UVB light at certain points of the day, that doesn't usually cost anything. You can just go outside, unless you live in a place that doesn't really get sunlight and you have to travel somewhere for it. Who knows? But, it's usually so achievable and so easy to do. It's just really about tweaking your habits.
Most definitely. Like when it comes in regards to your kids, as you're researching and learning, it's all about just continuing to pursue information and hear what your friends are saying, research that, make your own opinion, and then just understand everybody's in the same boat as you. We're all trying to learn and figure things out. And I think the most powerful question we can ask when we hear something from somebody is like, so why do you believe that? Or why do you do that? Or where did you read that? Because then you can go check out their sources and decide, is that something I want to adopt as part of my opinion? And I think a lot of times we just hear each other's opinion. We're just like, well, you're wrong. And it's like, well, why don't we just take a step back and just say, okay, where did you read that? How did you come to that decision?
Absolutely.
And then look at their sources. And then go from there.
And I love that question, because asking this question, because oftentimes you'll hear so much advice because of social media and just everybody knowing everything and having these strong opinions online and then in person, that it is important to vet your sources and make sure whatever you're hearing, or if there is something that you want to do or follow, perhaps doing your own research as well. Yeah. Well, I feel great about this conversation. I think this is a good end point. I like to keep things to an hour because most of the listeners here are busy moms. So we know how that goes. But Dr. Jess, if anybody wanted to get in touch with you, how can they find you?
You can get in touch with us. Our website is a good starting point. We have a ton of information on there, providence-chiropractic.com. You can always reach out to our team, call our office, ask us questions. Honestly, if you even are in a different location, you're not even in our area, and you say the question of, hey, can you try to help me find someone that would be a great person to take care of my health? Let us know. I mean, we don't mind hunting down sources for people. I do it all the time. And there's a multitude of questions that pop up in my office, and I'm always doing my best to try to get people the right resources or the right information so they can pursue their health journey the way they need to. So even if this isn't that way, you can reach out to us that way.
Absolutely. And this is how I found you. You were recommended from my old chiropractor. And oftentimes when you do find a good doctor, and if you are moving or looking in a different location, that is the best person to ask.
Yeah.
Absolutely. Well, thank you so much for coming on. This was such an amazing conversation. There was so much value in it. I'm so excited, and I do hope we do a part 2 soon.
I think we got plenty for a part 2.
So much to talk about. Yes. Thank you so much for tuning in today and being a part of the Livin'Sky community. I hope you learned something new and inspiring that you can apply in your life right away. If you have a minute, please leave us a 5-star review. It really helps us grow and for other parents like you to find us. If If you haven't done so already, make sure you subscribe to the show wherever you listen to your podcasts so you never miss an episode. Sending you and your family lots of love. I'll catch you in the next episode. Thanks so much for listening to the Livin'Sky podcast. If this episode resonated, please leave a quick 5-star review or share it with another parent who'd love it too. It really helps more families find the support that they need. And don't forget to join my newsletter at lenalivin'sky.com for more tips and free guides. Sending a little sunshine to your kitchen today. See you next time.